Hi there, it's Kathy. I'm going to talk to you today a little bit about Don't Ask, Don't Tell, which is my way of addressing the issue of breaking the stalemate or having those end of life conversations. End of life conversations are among the most challenging and emotionally charged dialogues in healthcare. Yet these discussions are vital for ensuring that your wishes or your loved one's wishes are respected and that they receive compassionate and appropriate care approaching end of life. Unfortunately, a don't ask, don't tell culture often pervades these conversations where families, patients avoid initiating talks about end of life plans, and healthcare professionals hesitate to bring them up. To move forward, someone needs to break the stalemate. So let's look at the reluctance of patients and families. For many people, talking about end of life issues is daunting and emotionally overwhelming. The very idea of discussing mortality is distressing, leading to a host of reasons why these conversations are avoided. We're fearful, we deny. Confronting the reality of a terminal illness or imminent death instills fear and anxiety in anybody. Patients and families cling to hope and deny the seriousness of the situation to avoid emotional pain, sense of loss. Then there's cultural and religious beliefs. Some cultures and religions place taboos on discussing death, or they openly discourage conversations about end-of-life preferences and plans. Maybe there's a lack of awareness. Patients and families might not realize the importance of discussing end-of-life care, therefore unaware of what's available. Let's flip that coin and look at the hesitation of healthcare professionals. Healthcare professionals, like myself, including other nurses, physicians, anybody involved working with patients, hesitate to initiate these end-of-life conversations for many reasons. It's uncomfortable first. Like patients, many healthcare providers feel uncomfortable discussing death and dying. This discomfort can come from a lack of training or just personal unease. There's uncertainty. Prognosticating life expectancy is fraught with uncertainty. Doctors fear giving patients and families false expectations or delivering news that causes emotional distress. What to do? Time constraints, and this is a big one. The fast-paced nature of healthcare limits the time physicians and nurses have to engage in meaningful end-of-life discussions. These conversations require sensitivity, empathy, and time, resources that are in short supply. So how do we break the stalemate? How do we move past this don't ask on the patient side and don't tell on the provider side culture? Well, it's crucial for someone, whether it's the patient, a family member, or a healthcare professional, to step up. Addressing end-of-life care proactively ensures better quality of life, respect for someone's wishes, and emotional preparing time for families. Some of the strategies to foster better communication include more professional education and training, increase the awareness for those of us as healthcare providers on handling these end-of-life discussions, helps alleviate some of the discomfort and uncertainty. Start the discussions earlier. Patients and families need to discuss end-of-life wishes early on, especially when there is a life-limiting or serious illness, rather than waiting for a crisis. During a crisis is not the time to have this conversation. Discuss advance directives. Encourage someone to complete an advance directive and appoint their healthcare proxies. These documents serve as guides for both families and healthcare professionals, reduce the uncertainty, and ensure that the person's wishes are honored. Consider in-home hospice care. Hospice care provides medical, emotional, full holistic support in the comfort of a person's home. You can contact the hospice agency for more information. Integrate palliative care. Palliative care earlier in the treatment process helps address physical, emotional, and spiritual pain and opens up these end-of-life conversations and is a natural part of the care continuum. There are also hospice house options. Hospice houses provide a comforting and supporting environment for individuals facing terminal illness, focusing on pain management and emotional support to enhance the life quality in the remaining days. They are staffed by compassionate healthcare professionals who assist both patients and families through the challenging time. See if they're available in your area. And access bereavement support groups. These groups offer emotional support and a sense of community to both family member and friends coping with loss. There's nothing like talking to people that are actually going through what you do. And then utilize volunteer companion programs. They offer social interaction and support for the person and for the entire family. So while not an easy conversation, it's one that we need to have with each other and with ourselves and with our healthcare providers. Don't wait for a crisis. It's not the best time to be making any decisions. Thank you for your time and listening today. I know this isn't an easy subject, but it's one that I went through recently, a few months ago, with a family member. And it was actually a family member I had to step up to start the conversation. And for those of you that have been through it, you know exactly what I'm talking about. So take care. And again, thank you for your time.